Down syndrome is an genetic disorder. Look at this picture shows that signs and symptoms. Look at this. A detail going on. Introduction. Down syndrome, also known as trisomy 21, is a genetic disorder caused by the presence of an extra copy of chromosome 21. It is the most common chromosomal abnormality in humans and leads to intellectual disability. Distinctive physical features and various health complications. It was first described by British physician John Langdon Down in 1866. A definition. Down syndrome is a congenital genetic disorder resulting from the presence of all or part of a third copy of chromosome 21. It is characterized by developmental delays, intellectual disability, characteristic facial features, and various health issues. Etymology. The term Down syndrome is named after Dr. John Langdon Down, the British physician who first described the condition in 1866. The word syndrome comes from the Greek syn, together, and dromen, to run, indicating a group of symptoms that consistently occur together. Epidemiology. Down syndrome occurs in approximately 1 in every 700 live births worldwide, making it the most common chromosomal disorder. The incidence increases with maternal age, though it can occur at any maternal age. Types. There are three types of Down syndrome. 1. Trisomy 21, 95%. Each cell has 3 copies of chromosomes 21. Most common form. 2. Translocation 4%. A part of chromosome 21 is attached, translocated to another chromosome. Can be inherited from a parent. Balanced translocation. 3. Mosaicism 1%. Some cells have an extra chromosome 21, others do not. May result in milder physical and intellectual features. Causes. 1. Non-disjunction during meiosis leads to an extra chromosome 21. 2. In translocation type, a piece of chromosome 21 breaks off and attaches to another chromosome. 3. Mosaicism occurs due to mitotic error after fertilization. Risk factors: 1. Advanced maternal age more than 35 years. 2. Family history of Down syndrome or genetic translocation. 3. Having had a previous child with Down syndrome. 4. Certain type of chromosomal rearrangements in one of the parents. Complications: 1. Congenital heart defects, example arterioventricular septal defects. 2. Gastrointestinal anomalies, example duodenal atresia, Erzberg disease. 3. Hearing and vision problems. 4. Thyroid dysfunction. 5. Obstructive sleep apnea. 6. Increased risk of leukemia. 7. Early onset Alzheimer's disease. 8. Immune system deficiencies. 9. Delayed motor and cognitive development. Pathophysiology. Pathophysiology of Down syndrome step-by-step process. 1. Chromosomal non-disjunction or abnormality. During meiosis, cell division of sperm or egg, chromosome 21 fails to separate properly. Non-disjunction. Or part or all of chromosome 21 is attached to another chromosome. Translocation or the error occur after fertilization. Mosaicism. 2. Formation of trisomy 21. The fertilized egg ends up with 3 copies of chromosome 21 instead of the normal 2 in all cells or a portion, depending on type. 3. The presence of a extra chromosome 21 causes over expression of approximately 300 to 500 genes located on that chromosome. These includes genes that regulate brain development, immune function, and heart formation. 4. Disruption of cellular process. The excess gene products interfere with normal cellular signaling, protein synthesis, oxidative stress response, and neural development. 5. Alternative development and organ function. This results in abnormal brain development causing intellectual disability. Congenital abnormalities such as heart defects and gastrointestinal malformations develop due to disrupted embryogenesis. 6. Neurological and physiological manifestations. The central nervous system is affected. leading to hypotonia, low muscle tone, and delayed milestones. Overexpression of APP gene on chromosome 21 increases the risk of early onset Alzheimer's disease. 7. Systemic effects. The immune system may be weakened, increasing susceptibility to infections. Other systems, endocrine, musculoskeletal, etc., are variably affected, contributing to multi-system disorder. This case code explains the complex clinical features observed in individuals with Down syndrome. Signs and symptoms. 1. Physical features. Flat facial profile, small head and ears, almond shaped eye with upward slant, short neck, protruding tongue, poor muscle tone, hypotonia, single deep rash across the palm, short structure. 2. Developmental signs. Delayed milestones, sitting, walking, talking, mild to moderate intellectual disability, speech and language difficulties, behavioral issues. 3. Medical issues. Frequent respiratory infections, hearing loss, visual impairment, gastrointestinal problems, heart defects. Diagnosis. Prenatal diagnosis. 1. Screening test, nuchal translucency ultrasound. First and second trimester serum markers, PAPPA, HCG. Non invasive prenatal testing, NIPT, via cell free fetal DNA. 2. Diagnostic tests, chronic bullous sampling, CVS, amniocentesis, precutaneous umbilical blood sampling, PUBS. 3. Postnatal diagnosis, physical examination at birth, karyotyping to confirm trisomy 21. Nursing diagnosis. 1. Delayed growth and development related to genetic disorder. 2. Impaired verbal communication due to cognitive delay. 3. Risk for infection related to compromised immune function. 4. Imbalanced nutrition less than body requirements related to feeding difficulties. 5. Compromised family coping related to chronic illness of the child. Medical management. 1. Cardiology, surgery for congenital heart defects. 2. Endocrinology, management of thyroid issues. 3. Audiology and ENT, hearing aids or surgical interventions. 4. Vision care, glasses or surgery for cataracts. 5. Immunization, ensure timely vaccinations. 6. Pediatrician, regular developmental assessment. Nursing management. 1. Monitor growth and developmental milestones. 2. Provide nutritional support and feeding techniques. 3. Teach parents about proper hygiene and infection prevention. 4. Coordinate interdisciplinary care, PT, OT, speech therapy. 5. Offer emotional support to family members. 6. Educate caregivers on the condition and home care requirements. Treatment options. There is no cure for Down syndrome, but supportive care includes 1. Early intervention program, birth to 3 years, speech, physical and occupational therapy. 2. Special education services, individualized education plan, IEP. 3. Surgical treatments for congenital anomalies. 4. Hearing or vision aids to improve sensory input. 5. Medication, thyroid hormones, treatment for infection, etc. Psychosocial medicine. 1. Family counseling helps families understand and cope with the diagnosis, enhances emotional resilience and planning. 2. Support groups connects families with others facing similar challenges, provides shared experiences and social support. 3. Behavioral therapy helps manage behavioral issues, promotes adaptive functioning and emotional regulation. 4. Social skills training encourage peer interaction and communication, prepares children for integration to society. 5. Community integration program encourages participation in school, recreation and employment, improves quality of life and social inclusion. Prevention. There is no way to prevent Down syndrome, but risk can be managed. 1. Genetic counseling for at-risk couples. 2. Prenatal testing for early detection. 3. Awareness of maternal age as a risk factor. 4. Education and informed reproductive choices. In conclusion, Down syndrome is a lifelong condition that impacts individuals physically, intellectually, and socially. Despite challenges, people with Down syndrome can lead fulfilling and productive life with appropriate medical care, early intervention, education, and social support. Advances in healthcare and awareness have significantly improved life expectancy and quality of life, empowering families and communities to support individuals with Down syndrome is key to their overall well being. Thank you. Have a nice day.